So we're really excited to have Becky here. She has had knee pain. And, like most people, as we get older, we still want to be active. We still want to play tennis. We still want to play pickleball. But when the knees get in the way, all of a sudden you kind of get these fears that, oh gosh, maybe I'm going to have to slow down or stop. And what else can I do? And she's also going to share her experience with shockwave therapy, which is some of the things that we used on her to help her get back to feeling great. So welcome, Becky.
Thank you. Thanks so much.
So tell us a little bit about your knee pain, how long you've had it, all that good stuff.
I probably had this particular problem for about 7 months now. And I will tell you that I started out with the orthopedic surgeon, um, done my other knee. And fortunately, he's not a very surgery happy kind of guy. The first time that I went in about 7 months ago, I did get a cortisone shot. It helped for probably 2 months,
Yep.
and I was right back in pain and had a lot of swelling. And I went back in, and he said, okay, let's give it one more month. Let's try a few other things. He actually suggested that physical therapy might be helpful. And anyway, I thought, I the crazy thing is I actually got a Sunday morning Empower newsletter that said I thought about shockwave therapy. And so I thought, well, I'm going to try everything I can before I go to surgery. So
Oh,
anyway,
absolutely.
so I called in and scheduled my first appointment. It was about maybe 5 or 6 weeks ago and started with shockwave therapy. My issue is I'm bone on bone, not a whole lot of cartilage left under my kneecap, and I have a lot of arthritis. Anyway, we started working on it. We did shockwave therapy, did some physical therapy, a lot of home exercise. And I will say, now what, maybe 6 weeks in, 5 or 6 weeks in, I am back to playing tennis and pickleball every day. So, yeah, it's been a great thing. So hopefully that month off the doctor gave me was going to turn into longer than that.
Yeah. Well, I mean, here's the problem. When you go and you just do injections, it just assumes that you only have a chemical problem, which most people don't. There's usually mechanics of things that aren't working. And I know for my knee, I mean, I've had multiple knee surgeries when this from just playing sports, and I was like, I'm not having another surgery. And I can remember when I first got Shockwave, I was like, I can't wait to use this because I've tried so many things, and I shockwaved all the muscles around the knee. And there's usually a lot of degenerative tissue that's in that area, and you just can't get it to fire or contract, or all it's doing is pulling on the knee. So it makes the knee feel like it's very arthritic. And even though people may be imaged, because I mean, let's face it, everyone that gets imaged as we get older is going to show arthritis, but is arthritis really the problem, or is it really something else that's going on? And so when you can shockwave those tissues, you can get that blood flow going back to it again. If there's any kind of scarring or adhesions, it just knocks those out. So then when you get to the strengthening phase of it, you actually can strengthen it. And then the muscles actually can support the knee, and then you start feeling better.
Yeah, and I think that's what's happened. I honestly believe that I have, much stronger muscles around my knee, and
Mhm.
maybe it's just taken a lot of the pressure off of
Absolutely. Yeah.
cap rubbing on my femur. So anyway, that's
Yeah,
been
and
good.
what people don't realize too, like you can go and get all the massages and things, but the shockwave can knock it out so much faster, and just really increase that blood flow that you just can't even get with a massage. So we've been getting like some amazing results, like so much faster. Like we even had a client that had a partial knee replacement and she needed it. I mean, it was from something else. Like she had another medical condition, and the drugs that she was taking basically like ate part of her joint. It was crazy. So she needed part of this, but she couldn't get back. She was like, I don't understand. And the doctors were like, well, everything's fine. I can't figure it, you're fine. And we couldn't get anything to contract. So we did shockwave. And I'm telling you, like within 2 visits, I'm like, holy cow, you can do that? You don't feel it in your knee? No, I feel it in my muscles. I'm like, awesome. And then she was just rocking and rolling because her tissue is so bad. that we had to get some help from that. So yeah, it's amazing. Tell us a little bit about like what your fears were if this like couldn't get solved.
Well, I've kind of felt like I was headed toward another knee surgery. I had one on my left knee. This is my right knee. And honestly, but that 4 years ago I had a back problem and I called you and you fixed that. So no surgery and life is good on my back. And so, my hope was that you could fix me again. again. And so anyway, at this juncture, my expectation is that knee surgery is not in my future.
Yeah, which is great because people start going down that path and you start having the fears. Well, how long is this going to last? And is it really going to help? And am I going to be able to continue to be active? I always laugh because I tell people, if I can't be active, then my husband will probably divorce me because I will be horrible to live with.
Well, and my doctor said, Becky, honestly, you can't play, 15 sports a week. And what I wanted to say is, no, I
What?
fit so that I can do what I want to do. So
Yes.
anyway.
And I'd be like, well, maybe you can't, but I'm going to find a way. Yeah, no. And I always tell people too, like, I'm finding things for me and then my patients benefit from it because I want to stay active. So I'm continuing to do research on what are some other things that I can bring in. And I have another device that I'm going to bring in next year that helps with like bone and things like that. Like it goes even deeper than Shockwave. So I can't wait to get that. I just have to pay off a few more things that I've bought from the office before I get more fun toys.
Well, maybe I'll be your first. I'll be your guinea pig on that.
Absolutely. Oh, well, I used it on my knee this weekend when I was at a conference. I'm like, yep, you sold me. I'm done. Yep, this will be coming into my office. It's just about another $40,000 piece of equipment, but I'll get it. It's going to happen next year. I just got to get some of these other things paid off. But yeah, no, I'm always looking for things that can help because I don't want to have surgery and I don't want to stop. And that's my patients are the same way. And you'll get doctors that will tell you that, like, well, no, you're just getting old. Like, just slow down. Like, you're retired. I'm like, well, my retirement and your retirement are completely different because I don't plan on slowing down. And you don't tell me that I can't do it because I'm going to find a way.
Right. That's why I retired so I could go enjoy life.
Exactly. Exactly. Not to go sit on the couch and like be lazy. Like that's not retirement. But yeah, no, we're so excited. What would you tell someone that is on the fence about coming in? Because I know you've been here a couple times with things that just weren't getting resolved.
Yeah, so I would say you've been a lifesaver. You and your team have been a lifesaver for me in two different instances where I think a lot of doctors would have said it's time to do, surgery or something more invasive. And so I've had the best of luck with guys. And so, you'll be my first choice before listening to, any kind of surgery options. So
Yeah.
it's been a great experience thus far.
Yeah. We have clients that will come to us before they see an orthopedic surgeon to get our opinion first. And obviously, like even at our office, there's times when we have to send people like you need to go get this checked out, but let's just get the information and we can sit down and have a conversation and figure out like what those next steps are. But it doesn't happen often. A lot of times we can help people. But there are occasions. I mean, we probably send maybe 2 people per year to surgery. That's it.
Yeah.
Which I think is remarkable because most people it's just like surgery,
Yeah.
medications, injections, and you don't have to live that way. So, well, awesome. I'm so glad. I love when people share their stories because other people can hear themselves in those stories and giving other people the belief that it's possible to feel better and to get back and not have to, go down the surgery route.
Yeah. More than possible. It is probable.
Exactly. Don't take it from me. Take it from Becky's mouth. I know I say it all the time, but it's really true.
As a matter of fact, I've got a pickleball match this morning. So, yep, I'm back out playing and life is good again.
So fun. Love pickleball. Pickleball is so fun in the sense that like it's very social, like it's almost more social, but I mean, you're gonna get a workout, depending on who you
Yeah,
play with. Some of my friends
yeah,
I don't. I'm like, think, okay, can you get it back? But most people, it's like they're very aggressive and competitive like me. So
I, yeah, I would say you get more in pickleball than actually tennis,
yeah,
and it is a much more social, fun
yeah,
sport.
it is. Awesome. Well, good. Well, get off to your pickleball match and we will see you later.
Okay, thanks, Stephanie.